Global CE Day. Tom Judd from CED. I'm here with Evenel Osias from Haiti, who is one of the leaders in the clinical engineering work in that country. Welcome, Evenel.
Yeah, thank you very much, Tom Judd, for inviting me to this Zoom meeting.
And so, Evenel, tell us about your role now and who you work with and some of the, how that flows for you.
Basically, I'm working in Haiti at Hôpital Bienfaisance de Pignon. I am the biomedical technician manager for the hospital, and I'm working in collaboration with the Dalton Foundation, based in Ohio, in the United States.
So, I've had the privilege of being in Haiti 3 times, so I act like I know a little bit, Evenel. So, Pignon, Pignon, where you work, is in the northern part, not the northernmost, but somewhat near Cap-Haïtien.
Cap-Haïtien.
Yeah, Cap-Haïtien and other places. It's one of the key hospitals. It's a place where a lot of training took place for biomedical technicians in recent years, and you were a part of that, I believe.
Yeah, basically, I know you heard about Dan Schuster.
Yep, Dan Schuster. He's one of our collaborators. Yep.
Yeah, he's one of my collaborators, and
like you're one of the CED collaborators also. Yeah, go ahead.
Correct. And I've been in training with Dan Schuster, organizing Cap-Haïtien at the Hôpital Justien.
Okay.
And in fact, I was the one starting a training at HUM in Mibale on the healthcare technology management the last time, like in January. So I've been chosen as the super tech to conduct training in the biomedical, as a biomedical technician for the healthcare technology management.
And so let me comment on that, Evenel. So in the last several years, one of our colleagues around the world, Billy Tenenty, trained about 50 through a series of trainings, 50 biomedical equipment technicians. And that was actually out of Pignon, as you may know, where you now work. But others have come in after Billy and also provided this excellent training like Dan Schuster has. And you're the best of those that were trained. So you're the trainer that's gone to train other people. And you mentioned Mirebalais. That's just, Port-au-Prince is in the center of the country, on the coast. And north of there, just over the mountains, is Mirebalais, which is the new sort of biggest and best hospital in the country. So to go there and do your health technology management training is a wonderful location, very central for many people in the country.
Okay, thank you.
And you're working for the Ray Dalton Foundation, as you mentioned, Ray Dalton, Barbara Campbell, and others and Ray is also a CED collaborator and a wonderful friend. So talk about what happened during COVID for you, Evenel, and your team. And maybe it's still happening.
Yeah, I agree. We still have COVID. Well, the COVID is still running in Haiti. Even it's not. It's kind of in our culture that people think they do not. The COVID is gone, but it's not. In fact, but during the COVID period of time, we struggled a lot because we cannot have anything like if you have like a piece of equipment broken, and you cannot have anything shipped to Haiti because of the restriction of sending stuff to Haiti. That's one of the biggest issue that we had during the COVID time. And you understand that we are located in Haiti, in Pignon, Haiti, which is about 3 hours from Port-au-Prince and 2 hours from Cap-Haïtien. And the COVID thing is like, having oxygen available all the time in case that we have a case coming to the hospital. So, and during that time, there was people blocking the woods, on the way going to Port-au-Prince or either going to Cap-Haïtien.
Yeah.
So we were able to, using our concentrator, oxygen concentrator, to make sure that we have, some oxygen available in case we have some COVID case. But unfortunately, we did not have any case, hospitalized at the hospital, but we did receive some suspect cases then they send to Mirbalais or to Cap-Haïtien where they have COVID center.
Yeah, larger centers, yeah. So what does your team do on a daily basis, Evenel, at Pignon?
My team on the my team on the daily basis, including myself as the manager, we kind of doing inspection of all the pieces of equipment that we have in the hospital, like in the emergency room, in the ICU, in the OR. So we kind of having like an inspection, time like every Monday and every Friday. So we do it every Monday because we make sure that after the weekend, 2 days like Saturday and Sunday, so things might not be working. So we go through all the system to make sure that we got everything working perfect, so that the medical staff can can start the day.
And how big is your team there? How big is your team?
We got like five, including myself.
Okay.
So we have 5 people, including myself. And also we do inspection on Friday because basically on weekend we don't have someone on staff, to take care of staff. So we do inspection on Friday and talk to the people, like the doctors and nurses, to say, hey, it's Friday, we're gonna leave. Is everything okay? But beside of the inspection thing, we do have a maintenance management system that I have created and put in place. So this system, this maintenance management system thing that I have created, I would say, give us like a maintenance plan of each piece of equipment at the hospital. So we inventory every piece of equipment at the hospital. We give them an ID, and the system that I created, establish a maintenance plan for each of equipment based on, every month or every 2 months or every 3 months. So like today, as Friday, I got in front of me, like right now, a list of like 6 pieces of equipment that I have to look at. They are not working. They're working perfectly. But this is the time to do maintenance, preventive maintenance on this piece of equipment.
Well, Evenel, tell us when you're, tell us
and
about
this
that.
Is how my system works.
Tell us about your health technology management course you were talking about in Mirbalais. How many people came and what were some of the topics?
The training held like in 3 days. It was the 22nd, 23rd, and 24th of January 2020, and we had 10 people coming to the training. We had part was like Mirbalais people, and we had 3 people coming from beyond. And the course was like on healthcare technology management, on how to manage the maintenance of the piece of the equipment. And the second part of the basic X-rays. And 2 other guys joined by Tom Managan.
That's great. I know we're having a little bit of a network challenges. Let's see if that resolves.
And we were like the 3 people. It was a great thing to conduct this healthcare technology management training, because this give even the administration, the people from the administration in Mirbalais, they were kind of come and follow this part, because it was very interesting. Because it's like you are in the hospital, you're fixing stuff every day, but you don't have any record of what you have been done. So if you don't have a piece of equipment, you don't have any story about this piece of equipment. How many times have you work on this piece of equipment? So when you receive this piece of equipment, was it donated? Was it purchased? So what did you do? So we take care of the medical equipment as a patient. As you get in the hospital, we give we set an ID for this piece of equipment, about this piece of equipment, like a patient coming to see a doctor. So we understand that in our clinic, I may gone to tomorrow, but if someone else coming to the system, we need to have something set in place so they can do the follow-up. It's like a patient coming to see a doctor. The doctor might leave tomorrow, but at least there is a record so that the next doctor can look at and see the status of this patient. That's how we treat our medical equipment.
Evenel, I'd love to hear about I've loved to hear about your CMMS and how you're not only doing that in your hospital but spreading it across the others, in the country. How do the biomed techs, do other engineers, do they communicate across the country very well? Do you guys ever come together, guys and gals?
Yeah, we do. We do have a network, like a WhatsApp group we created. So if there is a problem, if I have a problem like in PN right now with a piece of equipment, I just send a message through the group and I say, hey, I got this piece of equipment. This is the model number. This is the serial number. Here's a picture. This is what I found. Is anyone can help? And in a minute, so you will have people respond to this. So we created a WhatsApp group. So
how many people on your WhatsApp group these days?
For now, we have about 20.
Okay.
But
well, Evenel, through these interviews, I've learned that a colleague from Africa, from French-speaking Africa, which of course Haiti is French and Creole speaking besides English, that has two WhatsApp groups, one that has 80 people and another that has 30. But I want to connect you with Andre Mabule from Cameroon, because all you French speakers ought to get together and help each other. So okay. I hope we can do that.
That would be great.
So Evenel, what's your, in conclusion here, what's your vision for the future of clinical engineering and medical equipment management in Haiti?
I would say my vision for the clinical engineering in Haiti would be having a well-organized, dynamic team that is knowledgeable and supportive with mission. I want to promote the education of the organization employees in the continuous effort to improve quality care for the clients. That would be my vision. Make sure that we got a clinical engineering department set up with all the requirements, and then to make sure that we take care of all the medical devices to be beneficial to the patients.
Well, Evenel, I love your vision, and I know with people like yourself from Haiti, with people like Dan Schuster coming alongside, and people like Ray Dalton facilitating getting the right equipment on the front end, as well as helping you on the back end with sustainability, I think that vision could come true. So I'm pretty excited about that.
Thank you very much. And the only gift that I can give to myself is I don't have any temptation to leave Haiti. That's why I'm coming. I understand that people, they want to, they get their training and leave Haiti and going to the United States.
Right.
I would love to stay I would love to live in the United States. But the only gift that I can give to the nation is to come to Haiti, live in Haiti, and work for the people in Haiti. This is the only gift that I can give to Dalton Foundation, to every collaborator, to live in the country and serve the country.
It sounds like you're home.
Yes,
you're home.
Sir. Yes, sir.
Well, very good, Evenel. Thanks for your time today.
No, it's a pleasure, Tom. And thank you very much for inviting me to this Zoom meeting. And my time is your time anytime.
I appreciate it, brother. Talk to you soon. Bye for now.
Thank you. Okay, bye-bye.